Off on the issue. New at 6, 12 News' Kent Wainscott is in the WISN.com center with details of the showdown.
Yeah, the congressional debate came to town. On one side, it was Democrat Gwen Moore pushing for the current health care proposal, and on the other, Republican Paul Ryan arguing that the plan should be scrapped. The two faced off in front of a panel of journalists and a crowd of questioners at the Milwaukee Press Club.
To determine how care is to be delivered in America?
There were no surprises from the two representatives today, neither budging from their position on health care reform. Congresswoman Moore saying she believes a public option is essential to the success of any reform plan.
To have a public option plan, which will in fact not crowd out private insurance, but will be there much as Medicare is to maintain some semblance of cost control over the rising cost of premiums in this country.
While Congressman Ryan says the public option in the current Democratic plan before Congress is just the first step in a government takeover of health care.
I think the bill is more or less designed to have the government in an incremental way, but a fairly quick way, have the government essentially become the primary or single payer of health care in America.
The two spoke before a small crowd, which was in contrast to the hundreds of people who've turned out at their town hall meetings in recent weeks. Moore told 12 News those sessions have helped clear up misconceptions about the health care plan.
I think that we have sort of deflated some of the scare tactics because I really did deliberately respond to some of the stuff about the death panels and so on.
Ryan says the public response will have an impact in Congress, but isn't sure whether it will change the outcome of the debate.
What I've heard from my constituents, whether it's town hall meetings, phones, or mail, they don't like this bill. They want to see this thing get scrapped and start over. The question is, will that impact votes among Democrats?
And both representatives say they're anxious to resume the real debate on that health care bill on Capitol Hill when Congress returns to work early next month.